This recording will go over polycythemia vera. With anemia, we worry about too few red blood cells. With polycythemia vera, we worry about too many blood cells. It's a bone marrow disorder. The big problem is when we have too many blood cells, the blood actually gets thick and then clots can form. Where anemia is a concern about not enough red blood cells and low oxygen, polycythemia vera is a problem with the blood becoming too thick to circulate properly, and the patient experiences problems with the blood cells created in the bone marrow. So even though there's a lot of them, they don't function right. Polycythemia vera is a chronic bone marrow disorder that causes an overproduction of red blood cells, as well as an increased number of white blood cells and platelets. Too many blood cells make the blood thick. Another term for that is hyperviscosity, or you might hear about the blood being viscous or thick. That leads to poor circulation, and when we know that when blood isn't flowing properly, if it becomes a little stagnant or you have some blood stasis, not flowing well, we're at risk for clot formation. Almost all patients with polycythemia vera have a genetic mutation that causes a loss of cellular regulation over blood cells. This increases blood volume and viscosity, and then it decreases blood flow, which puts the patient at risk for thrombosis or clots. The three major hallmarks for polycythemia vera are massive production of red blood cells, excessive leukocyte production, and excessive platelet production. So we have pancytosis. Everything is high with polycythemia vera. Some symptoms that we could see when thick blood isn't flowing properly include headache and dizziness when the brain's not being perfused well, blurred vision because hyperviscosity can impair retinal circulation, causing visual disturbances, hypertension. The increased blood volume and the resistance will elevate blood pressure. Tinnitus or ringing of the ears can occur because of altered blood flow to auditory structures. With all of these symptoms, it's a circulation problem, not an oxygenation problem. Some signs and symptoms that we see with polycythemia vera include a ruddy complexion or a reddish skin tone from the excess red blood cells near the surface. Warm skin because an increased blood volume raises skin temperature. Splenomegaly, where the spleen enlarges as it processes out the excess blood cells. Pruritus or itchiness after a warm bath especially can occur. It's a unique hallmark of polycythemia vera. Itching is triggered by warm water due to histamine release from activated mast cells. Also, we worry because although we have an increase in platelets, they don't function properly. So we worry about bleeding risks for this population. We already spoke about increased risk of hypertension. And then because of the stasis of the blood, we worry about thrombosis or clot formation. And although the number of cells in the blood is increased, not just both, but all the red blood cell, white blood cells, and platelets, the cells aren't completely normal, so they don't function right, and the cell lifespan is shorter. When these cells die with these shortened lifespans, the parts and pieces of the cell then plug up the blood even more, and there's an increase of uric acid and potassium, which normally reside within the cell, that build up in the blood and can lead to problems in the kidneys and also problems with gout. And even though the number of red blood cells is increased, remember it's not functioning properly, so it's not able to carry oxygen like it should, and the patient can experience hypoxia. Even though the patient has increased white blood cells, they're not working right, so the patient's at increased risk for infection. And even though the patient has increased number of platelets in the blood, they're not working properly, so the patient has increased risk for bleeding. One of the biggest risk factors for the patient with polycythemia vera is that an increased risk for clotting. So we're worried about a clot forming because the blood's not flowing like it should. And then if that clot travels to the brain, the patient could have a stroke. If the clot travels to a coronary artery, The patient could have a heart attack or a myocardial infarction. If the clot travels to the leg, or it could even form in the leg, I guess, as a DVT and then travel elsewhere. A clot forming in the leg because of stasis would occur or be more likely in a patient with polycythemia vera. Key lab findings for the patient with polycythemia vera include increased red blood cells and H&H, hematocrit, and hemoglobin. Hematocrit is the primary lab that we're looking at and monitoring with polycythemia vera. A bone marrow biopsy reveals hypercellularity, or a lot of cells being produced. Blood viscosity can be measured and measured as increase, and we can also look for genetic mutations that can confirm the polycythemia vera diagnosis. One treatment option for polycythemia vera is therapeutic phlebotomy, and that includes removing whole blood to lower the red blood cell count. It would be performed regularly as ongoing management. The treatment goal is to maintain hematocrit at a safe target level to prevent hyperviscosity complications. So with therapeutic phlebotomy, you can think of it as draining some of the excessive blood to help thin out the blood of the patient. Another treatment option is apheresis, which uses a machine to remove only red blood cells and then return the plasma and platelets back to the body. This treatment is more precise and requires less frequent treatment than therapeutic phlebotomy. Think of it as selective blood removal. We'll remove the blood, take out just what we don't want, those excessive red blood cells, and then put everything back in the patient. Medications used to treat polycythemia vera include hydroxyurea, which suppresses bone marrow production to reduce excess cell counts over time, low-dose aspirin, which reduces platelet aggregation to prevent clot formation, interferon, which suppresses abnormal cell production, and the JAK2 inhibitors, which directly target those genetic mutations that are producing the overproduction of blood cells. We said that clots are a big risk for this population, so things we can do to prevent thrombosis include encouraging hydration. By ensuring adequate fluid intake, we decrease blood viscosity. It's very simple, but it helps to keep the blood thin and less likely to cause clots. Promoting mobility, regular movement prevents venous stasis and reduces DVT risk in hospitalized patients, and avoiding prolonged sitting. Prolonged immobility dramatically increases clot risks, so make sure we educate our patients to move frequently. Another teaching point for our patients with polycythemia vera is to avoid hot showers. That hot water can trigger a histamine release, worsening their pruritus. So they want to use cool or lukewarm water, apply moisturizers after bathing, and use antihistamines if necessary to treat pruritus. Patient education includes advising the patient to take all medications as prescribed. Encourage the patient to stay hydrated. Remember, that helps keep the blood thin, less likely to form clots. Encourage cool baths versus hot showers or baths, which can cause or could increase the pruritus, and refrain from scratching the skin, which can cause secondary infections. We want to avoid constrictive tight clothing because that can impede circulation. We don't want any roadblocks in our vessels, so we don't want to be squeezing them with tight belts or anything of that sort. We want to elevate the feet, wear TED hose. Those help to promote venous return back to the heart. And we want to avoid cold temperatures because remember, cold temperatures are going to cause vasoconstriction, which will make it more difficult for that thicker blood to flow. Finally, we want to make sure we are monitoring for bleeding in our patient and using bleeding precautions. And we want to advise the patient to stop activity if any chest pain occurs because that could indicate that a clot has traveled to a coronary artery and caused an MI. Remember, even though the platelet count is high, they're not functioning properly, so the patient's at risk for bleeding and clotting. Make sure we're doing neural checks. We're watching for stroke symptoms, which is an emergency. And any new neural change, any change in a patient period, makes them a high priority patient. Keep in mind complications you can see with this populations population of patients with polycythemia vera, which would include stroke symptoms such as sudden weakness, facial droop, slurred speech, or vision loss. You want to see them immediately. Severe headache or vision change could be a sign of impending cerebrovascular event or also a problem in the brain. And other emergency things that would need priority intervention would be signs of DVT or myocardial infarction, such as chest pain for the MI, leg swelling or warmth with the DVT. In terms of prioritization, remember your A, B, C, D, E primary survey. AB is respiratory, C circulatory, D is neural. To wrap up, remember that polycythemia vera, poly means many, it's too many cells, and cythemia is blood cells. Vera, we're talking about a primary bone marrow disorder. Thick blood leads to increased risk for clots. That hyperviscosity can lead to, that's another term for thick blood, and when blood is thick, it doesn't move properly and puts the patient at increased risk for clots. Pruritus after a bath, especially a hot bath, is something that we'll be watching for. And phlebotomy is the first line treatment where we're taking out blood to help thin the blood or reduce the viscosity. Apheresis is similar, but in that case, we only take out part of the blood, the red blood cells, and return the blood back to the patient. So where anemia is not enough red blood cells, polycythemia vera is a cancer of the red blood cell where we have excessive red blood cell. But it's not just the red blood cells, it's the white blood cells and platelets also. But those cells don't function properly. And because we have extra cells in the blood becomes thick and doesn't flow like it should.